It's 12:15. My name is Bianca, and we appreciate everyone for joining. If you have any trouble hearing, listening, seeing, feel free to put it in the chat, and I'll do what I can. I'm also going to be following up with you individually to see how Saebo can best support you and include resources that we'll talk about today. Again, my name is Bianca, and I have the pleasure of having Shelley Waller as the host. She's got 26 years as a practicing clinician, and 16 years she's been instructing for Saebo. And I'll let her go ahead and talk about it. And this 30 minutes is going to go pretty quick. And our hope is that we're going to get to as many questions as possible. And should we not get to your question, fear not. Like I said, I'll be reaching out personally. So welcome and take it away, Shelley.
All right, thank you. Like Bianca said, I have been an OT for 26 years and have worked in neuro predominantly. And I will tell you, I'm going to talk to you about a piece of equipment that I pretty much cannot live without anymore in my clinic. The mobile arm support for me was such a game changer, and I hope that you will see that too. So I don't know if any of you have ever seen any of these prehistoric arm supports in your past. The deltoid aid is definitely one that I have used before, and you can probably find it in the depths of a closet along with some other dusty things these days. So just mobile arm supports in general. What are they for? So they are gravity supported devices that could be mounted on wheelchairs or tables, and they help support people with weak upper limbs to improve their function. They also allow people to perform their ADLs, such as feeding, grooming, hygiene, riding, just giving them that proximal support. They're most commonly used for neurological patients suffering from hemiparesis, but is definitely not limited to just that population. And we'll talk about that a little bit as well. The mobile arm supports have been around since the 50s. So the idea of us as therapists needing help to eliminate gravity and to allow for that volitional movement, the idea has been around for a long time. So I will show you. This is our Saebo mobile arm support. We call it the SaeboMAS. And it is a zero gravity dynamic mobile arm support. And it was specifically designed to facilitate as well as challenge the weakened shoulder and elbow during functional tasks and exercise drills. So, in addition to supporting the upper extremity, it is going to help approximate and put that shoulder joint where it needs to be while the patient is doing functional reaching, exercising, and ADLs. It has a tension scale set to it, so that is allowing you to measure how much assistance you are giving the patient to help hold them into that gravity eliminated position. We have some videos of patients using the device. This gentleman suffered from a CVA, and you can tell he is trying to grasp the ball and put it into the bucket. He's using one of our Saebo flexes, which you don't have to use the mobile arm support with, but this is just an exercise activity that we're showing you. So again, you can see this woman, she's using a lot of compensation. When we get her into the mobile arm support, now she's not having to use all of that compensation, not using those traps as much, and actually getting good movement from the muscles that we want to engage. Again, this gentleman is trying to do some shoulder flexion while he's grasping the ball. We give him just that little bit of support and have taken away a little bit of gravity, but they're also using their volitional movement during these activities. Here is another gentleman. He has had a spinal cord injury, using it during just exercise drills. So reaching for targets placed in different areas, trying to recruit those proximal muscles for strengthening. The mobile arm support will be able to pick up a 1 out of 5 shoulder strength, which is really incredible. And I love seeing that during the treatment, especially for the patients who really don't believe that they have that muscle strength. 1 out of 5 is really hard to prove to a patient that they have when we're doing active assist. But when they get in this and they see that they're the ones moving the device and we're not, it is really encouraging for them. You can use the mobile arm support for a lot of different functional activities as well. So you can use it in the kitchen for cooking, for meal prep, for feeding, for IADLs. There are a lot of ways to be able to incorporate it. And I'm going to show you in a few minutes that it is on, we have one that is on a rolling base. So you can take it into the kitchen, you can take it into the bedroom, you can take it into um, you know, anywhere you need to go up to the sink, up to the stove, and be able to incorporate it into your activities. We also have a SaeboMAS Mini, and this is for it was made for people to be able to have a device at home. So the difference with this one is that it is not on a rolling base, but it attaches to a table, and they can use it for their ADLs, for their IADLs. Here's a video of a woman who is using the mobile arm support, and not only for feeding and hygiene, but for some of the fun stuff too. So being able to incorporate their hand into activities and be able to do bilateral activities throughout their day is what it's all about, right? Being able to, and the more that they incorporate it into their daily routine, the stronger those muscles are going to get, and they're going to be able to use it better. And here's another gentleman, his little smirk. I love his little smirk. So he's trying as hard as he can to grab the ball off the table, squeeze at the same time, and lift his arm at the same time. And so now when we get him into the mini, he's able to do that. So a lot of times too, thinking about squeezing, thinking about lifting their arm, it's so much for them to have to think about. So to be able to give them just that little bit of boost, eliminate some gravity so they don't have to do that compensation. They're able to focus on their grasp and release or their fine motor coordination if their upper extremity is supported a little bit more too. You're able to move into different directions. So I don't know if you noticed, but on the first video, he was grasping and moving out into abduction. This one, he's moving into adduction. With the mobile arm support, they literally can move into any direction you can think of. Shoulder extension, flexion, abduction. It has an internal, external rotation piece, supination, pronation, and I'll show you that when we do the practical part. Okay. We also have a demo that you can get for the SaeboMAS. So it's a free demo. We would ship you a full size mobile arm support, and you can try it for 14 days. Um, and it would come with individualized training. So it would come with me explaining to you kind of the ins and outs and tips and tricks on where to put the patient, how to set it up, what all the knobs are for, and then you get it for 14 days to be able to use it with your clients and to be able to see if it's something that you think would be suitable for your clinic. Okay. We also have a portal that Bianca's going to send that to you after we're finished with this webinar. And it has links on just an introduction to the mobile arm support, but it also has links to different exercises that you can do with it. And I think that's always good, just to have a lot of different ideas clinically on how to incorporate the equipment into your day. And we also have a free CEU for the mobile arm support. And I mean, who doesn't like a free CEU, first of all? But this course is going to take you a little bit more in depth through the evidence-based research on using a mobile arm support during functional activity for your patient. All right. And now I'm going to show you just some different ideas and show you a little bit more about the device. I'm going to turn this on. Okay. All right. So, okay. So I'm going to show you, I'm going to kind of lower mine down a little bit just so you can see. This is the full size mobile arm support, and you can see that it has the base at the bottom of it. And it can be used in so many different situations. So you can use it in sitting, you can use it in sideline, standing. I love to use it with the standing frame with a patient. When we get them in the standing frames and we kind of get this lean and we're putting pillows and everything underneath them. One of the reasons is because that affected side is not supported. Once we get that arm supported and up, all of a sudden they're weight bearing between both lower extremities. They've got a good base of support and they're able to do a good bilateral activity with it. It has a knob here that allows for it to be lowered if somebody is sitting or raised up if they're standing. Like I said before, you can roll it into any place you want. So I've taken it into the kitchen, into the bathroom. You can move it anywhere really in the clinic that you need to. I also use it for if you have like a BITS or a Dynavision, having the patient up in a gravity eliminated position. Now they're able to reach for those targets and they're supported. And that way they can get this mass repetition, which is what we want for them, right? So we can do active assistive range of motion so many times, but them being able to use their volitional movement in the mobile arm support while they're standing and get that mass repetition, that motor planning and cortical plasticity, that is all going to just start happening because you're able to get in so many more of those repetitions. Who's appropriate? So obviously people, if they have hemiparesis, that weakness in their arm, they are going to be appropriate for it. Sometimes I have questions of, well, what if my patient has shoulder subluxation? And my answer is that is really what this is for. So if you can imagine, you have that separation, but now you have the support, you have them, it approximates their shoulder into the position it's supposed to be in. When they're doing their active assistive range of motion, they're not getting any impingements because it's in the position that it's supposed to be. So it is really great for people who have shoulder subluxation. It really decreases that amount of pain, decreases the amount of compensations. Um, if you have somebody who has orthopedic problems also, so if you have arthritis or radial nerve, or I'm sorry, if they have brachial plexus injury, um, if rotator cuff tear, all of those weaknesses, this is going to be able to help them again, just decrease some of that heaviness and be able to get a lot of the repetitions in. Um, let's see. There's a couple of pieces that I'll show you. So typically, what I do, I feel like I need to get you here. Okay. It has the forearm shell here that the patient's arm is just going to slide into. And we want it to get close to that elbow bend that we can. So it's going to help support them in their heaviest part. And when they are doing functional reaching, I can come across here and I'm going to give them that tension. I'm going to set that tension. So I'm going to turn it. As I'm turning it, that's what's going to give them the assistance and hold them into this approximated position. Okay. It also has a knob that you can open. So if you pull this knob open on the side, this will allow for internal and external rotation. And this is great for if somebody's using it for a self-feeder, so they can internally rotate to scoop up their food, externally rotate to bring it to their mouth. If they need to do hygiene, so if they are going to do brushing their hair, brushing their teeth, it's going to allow for that internal external rotation. We do have an elbow stop that goes with it. So if they need assistance during that external rotation, you can add that elbow stop to it, and it's going to help support that elbow so when they externally rotate, their arm's not going to fall out of it. Okay. We also have an attachment that allows for supination and pronation as well. And that just is going to attach to the same place that this guy is. So if you're doing meal prep and you need to be able to pour, it's going to allow for that supination, pronation, external and internal rotation too during those activities. Okay. One of the other things that I love to use with this in combination is trigger stim therapy. So if you, let's say you have somebody in the device and you have them supported and they're lacking elbow extension. So I can hook up my trigger stim, e-stim, to their triceps. When they're coming across, they can pick up an object. If I want them to be able to extend out and to drop it out here, I can trigger stim them into elbow extension and then let go of the button and they can let go of the device. So they can come across, pick up the device. I help them extend their elbow with the stim and they can let go. If I have somebody who has no movement at all, I can hook up, let's say their adductors. I can set a target up over here, and as I'm holding the trigger stim, it's stimming them into adduction, get them to the target. I let go, they can come back across. We can stim again, go back across. And that's going to just help get those repetitions in and kind of wake those muscles up. Sometimes too, if the movement is just not there because of motor planning, if you combine the two, trigger stim and the mobile arm support, you might only need to do 20 to 30 reps and then stop the stim, and they might really just be able to carry on. The carryover is great with the combination of those. Documentation wise, you are going to document just as you would your regular functional activity, neuro reeducation. But like I said, you're going to be able to incorporate it into so many more activities, just being able to do so many more repetitions as well. Okay. Like I said before, one of my favorite things to do with it is to work with somebody in Sideline. So if you have a patient who, let's say, is very guarded because they have so much pain. So you could have them in it, but they're still guarding and kind of still, get moving just little bits this way. If you use it in Sideline, and this is going to be on that portal that I'm going to send you the videos. There's some great videos on how to set it up. But if you set them up here, and what you would do is actually take the base and go right up to the mat, you would have them lay on their non-affected side, and their affected side would be parallel to the ground. And now they can get a full shoulder flexion to extension this way, but also they're going to calm down and quiet down those traps. So they're not going to be guarding as much because you have them in Sideline. The other thing that is great for Sideline is that I can then get behind them and I can do my scapular glides. I can help them with my manual treatment because they are supported. So it's really giving the therapist another set of hands to be able to move targets or to help problem solve a grasp or release or watch vision. And it just is truly an amazing piece of equipment that I think you absolutely would love. What do you think? Do we have any questions?
Yep, I was just about to open it up for questions. And if
Okay.
you guys have questions, please put them in the chat and we'll fire away. And if anybody has a mobile arm support, at their facility and they need more training, know that that's available and free. And if you have one and you've got a question or you want to make a comment about it, you're welcome to put that in the chat too.
We do Zooms with the therapist and your patient with the device also. So if you have it and it's just not, you don't feel like it's set up the right way, I can meet with you and your patient, and we can do Zoom and try to problem solve together as well.
There's no questions, but I'll just pose one that we often get. If the MAS money is covered by insurance for home use, and that's typically a no, but we're definitely willing to check and work with the client. But it's typically purchased out of pocket by the client. Oh, we do have one. How portable is the SaeboMAS? Will it go in a car?
All right. Yes, it will, because I've had it in my car many times. So I can show you real quick the bottom of it. Um, it's really just two pieces, so you can unscrew it from the base. And so this part lifts up, and then it just has the base at the bottom of it. And those are the two parts that you would have to move.
In addition, we have a question that does it matter which direction the legs of the SaeboMAS are facing? Parallel to the patient versus perpendicular to the patient?
So you can do both. I prefer to do parallel to the patient. The one thing is you want to make sure that the patient is on the outside of the base, not on the inside. So the patient needs to be out here. If you want to do it the other way, it can be this way, but again, the patient needs to be further outside and not close in. So about 3 feet away from that base bar.
We also have, can it be mounted on a wheelchair or power chair?
It cannot. This is we have the base or the vise for the table.
Correct, because we don't have, we'd be making a ton of mounts.
Right.
Yeah. And we had a comment. Thank you, Maria, for sharing. So her facility has this device and how do we go about, oh, we have a mobile arm support at my facility. How do we go about getting those attachments you were talking about? I'll be following up with you, Maria, to help you with that and also make sure you know how to use them too. And then Rachel commented that they have this Sabo mobile arm support, started using it with spinal cord injury clients, and it has been great to start self-feeding. It takes a few tries to set up, but we're loving it. And to Shelly's point, even scheduling a Zoom with her and including a client is very helpful because she can show you right there in real time what adjustments need to be made as well. And then Dawn asked, how much is the SaeboMAS and the SaeboMAS Mini? I'll be providing that information. I know we should have some international callers on here, so there is different pricing across the globe, but I'll be following up depending on where you're from with that too. And we're reaching about 2 more minutes before we sign off and welcome, any additional comments, questions. Oh, here was a great one I missed. I'm sorry.
Oh,
How much tension pounds per resistance level? That was one thing that you didn't talk about, Shelley, when it comes to bringing them up into.
like how much you need.
Mhm.
So I usually give them as much assistance as it takes to get them to about 65 or 70 degrees shoulder flexion, and that it'll hold them there. So if I can let go and they stay at 65 or 70 degrees, that's kind of a good starting place for them. You don't want to go up to like 90 because then you don't really have anywhere to reach, but you want to give them enough assistance to make it a little bit easier.
Yeah.
Good question.
Yep. So lastly, the question was wanting to know if we'll be sending out the link to the video exercises. Absolutely. We'll be sending that to all the participants, even if you didn't show up, you'll be getting an email. Good question about, so we have one about, do you find patients are compliant with use at home?
They absolutely love it at home. It just gives them so much more independence and they want to use it. It it helps with all aspects of their life and they're able to move their arm. A lot of times, when we send them home and they don't have anything like this, they're not able to incorporate their hand in it and their arm into any of their activities. If they have one at home, I've had they definitely use it.
Another one is the resistance measured by pounds.
I
I might be able to help with that.
don't know
So
that.
it there is no equivalent. So she showed you a one slide where it was the tension scale, and it will indicate, and where how much assistance it's offering, what number it's on, but it doesn't necessarily equate to pounds or some type of numerical value.
Right.
One might think about it kind of like a red TheraBand versus a yellow TheraBand. Um, but it is great to motivate clients, say, oh, last week you were on level 7 and this week you only need level 5. And as you've experienced, Shelley, that could be day to day.
Well,
The
and it does change with like position too, like how much assistance they need in sideline versus sitting versus how far you're having them reach. One of the things that I do is I just document, patient requires tension level 7 during sitting activity and functional, just so I know what I did the day before, and maybe if I am not there, then a therapist who is coming to help has a gauge to know where to start.
Great,
But
12:46
all
Eastern, and
right.
so grateful for everyone that joined, and have a
Yes.
great rest of your day.
Take care. Thank you.
Bye.